Community Clinic. Healthcare is about people. It's about the practice of preventative care and access to health facilities. A person's health is also built upon several other factors, which begin with age, gender, and genetics. These, combined with diet, exercise, and unhealthy habits, such as smoking, provide building blocks for long-term health. So, good health is a product of good genes and good choice? Yes, but it's more complicated than that. Health is built upon several factors. In addition to health access and healthy choices, a third important category is determined by conditions in which people are born, grow up, live, work, and age. These factors, known as social determinants of health, refer to barriers that interfere with affording, accessing, and choosing the best options for care. In addition to natural factors and healthy choices, social determinants that are barriers to long-term health are poverty, education, discrimination, and living environment. These barriers can make healthcare more challenging for patients and for providers. At NorthLakes Community Clinic, it's our mission to identify such barriers within our communities and provide services that level the playing field for patients who need them. Let's look closely at one such area: literacy and health literacy. Literacy refers to a person's ability to read and write. 1 in 4 Wisconsin adults have low literacy skills. Health literacy refers to a person's ability to understand basic health information and services, including diagnosis, prescriptions, and navigating insurance and benefits. Imagine not being able to read or write and then navigating a system that is complex for most educated adults.
Okay, you can choose regal equine therapy or fragment adhesion cranioplasty. Which would you prefer?
Lower reading levels affect patients from the moment they enter into a clinic and are asked to fill out forms. Misunderstanding can continue into the exam room, where providers might use complicated terms to explain health issues. Additionally, if providers hand out pamphlets rather than having a conversation about their visit, an illiterate patient may misunderstand their diagnosis. If prescribed medication, this patient may have trouble taking it correctly. At NorthLakes, we provide several safety nets for patients, such as empathy and understanding, easy-to-read forms, in-person registration, and translation services for non-English speaking patients. Also, our resource coordinators are a vital help in connecting patients with services inside and outside of our organization, with help in understanding diagnosis, and also help with insurance and benefits. Within the exam room, our providers treat each appointment as a conversation. We give patients time to discuss any concerns they are comfortable with sharing. And lastly, we attempt to address literacy at a basic level and proudly have a team of dedicated employees that volunteer their time and read with youth groups to encourage our young community on the importance of reading. NorthLakes Community Clinic, keeping your wellness in mind. In Ashland, Washburn, Iron River, Hayward, Minong, Turtle Lake, and Balsam Lake.